Hello, everyone. It's Monday, May the 9th. I'm sure this is because over the weekend, and a lot of times over the weekend, we don't get all the deaths processed and everything, but we only have two, and I hope and pray this is correct. I want your prayers for these great, West Virginians that we've lost, but our 6,881st death in West Virginia is a 66-year-old female from Berkeley County. Our 6,882nd death is an 83-year-old female from Hampshire County. Please keep them in your prayers. If you know them, reach out, please. Active cases are still continuing to climb. They're 1,343 now. 877 new positive cases in the last 24 hours. Daily positivity rate is up to 8.91. Cumulative rate is at 8.10. Recovered cases still just a little above 495,000. We have 101 hospitalized, 25 in the ICU units, and 16 on ventilators. And we have a whole lot of yellow counties in West Virginia now. We've got 15, and you'll see that as we pull up our map. We're going to very, very soon lower our flags to half staff again. I have issued a proclamation ordering all U.S. and West Virginia flags at the Capitol Complex and all state-owned facilities in Braxton County to half staff. From dawn to dusk on Tuesday, May the 10th, 2022. And this is really celebrating an incredible life, an incredible act of bravery by John D. Forbush. John, 24-year-old, entered the river to try to save a woman and a child that were trapped in a vehicle. He was unable to free them, lost his life doing exactly that courageous deed. His funeral will be held at the Gasaway Baptist Church tomorrow at 11 a.m. I can't tell you enough about how great these people are, how much they give, and so it's a great honor to be able to do this for John D. Forbush and everything in his family. I remind you about your booster shots. I've said it 1,000 times. If you're out, on your booster as far as the months and everything, you don't have hardly any protection whatsoever, please go get that booster shot. We still make slow but sure headway. We're up to 72.2% of the 18 and over now that have had at least one shot. We'll continue to give those shots. We've given 477,743 booster shots, and we need that number to continue to climb. It continues to go up, just like I think General Hoyer was telling us the other day. Over 6,400 people that had received, their first vaccine in the last 30 days. There's no question we've saved a bunch of lives in doing so. We want to continue to be able to do just that. The new vaccine calculator is still up there. It will remind you when to get your shot. We thank WVU, we thank Clay Marsh, we thank General Hoyer, but a lot of people really put in the licks to make that happen. I've talked to you about your booster shot. All the COVID-19 vaccine info stuff is up on our website, as well as all the free testing information. There's 27 long-term care outbreaks right now, none in the church communities. We're going up a little bit in corrections, but the numbers are really low, 14 inmates and 15 staff cases. I remind you about the rental assistance program, and it is for renters and landlords. And the landlords have to have some level of assistance from the renters, but nevertheless, that program is still available. There's real dollars there that can help you, and as well as turn into multiplier effect dollars that can help West Virginia. The same is true for the homeowners assistance program. It's up there, and if you're a homeowner in West Virginia and you've gotten behind on certain things and everything, please call us and see if you qualify. I remind you about giving blood. Over and over and over, I've told you about that. I tell you how good our little Jumpstart program, Job Jumpstart program is done. And we've gotten more people into the workforce. Our unemployment numbers are at historic lows and everything. It seems like we take way too much for granted, but we still want to continue to try to get every single person in West Virginia a job if we can pull it off. I just got back from Huntington. You know, I was joined by Mayor Steve Williams and Homeland Security Secretary Jeff Sandy. I had my chief of staff and some other folks, you know, with me today, but we toured around, you know, a good bit of the flooding that had just recently happened, and it's a shame, you know, if you'll just step back and think about this for a second. You know, 5 or 6 years ago, we didn't have the ability to fix something, you know, in the state of West Virginia because we were scrambling around dead broke. And today, you know, things have really changed. And so we do have dollars. And we do have an ARPA program that's out there that provides all kinds of infrastructure and different things that we can do. There are opportunities right now in West Virginia. These folks need us. That's all there is to it. They need us. This little stream that runs down through Ritter Park, Four-Pole Creek, you know, it goes by so many residences, it's unbelievable. And with all that being said, this little stream, this little mud-bottom stream, absolutely just turned loose its impact. We had 5 inches of rain in a relatively short period of time. West Virginia can't stand that. But this little stream, we absolutely we could come up with ways to prevent this from happening. If you see these folks, and I've been there, I've seen it. I've seen the tragedy, you know, beyond belief. I saw so many that lost their lives. But with all that, it's just absolutely, if it doesn't touch your soul, to see people hauling all their memories, all of their lifelong memories from their homes, their pictures, absolutely on and on and on, piling them up in a pile in the street with mud all over them. And then an inloader come by and pick them up and throw them in the back of a dump truck and off they go. And there's not anything else to do because those memories that they have are absolutely cluttered with mud and everything under the sun. It's really sad. And to know that we can do something about it and we need to get at doing it, that's all there is to it. So I can promise you from the standpoint of, you know, Mayor Williams and myself and anybody and everybody else that's involved, all of our different agencies and on, if we absolutely can just find ways to do stuff, to do things to prevent these disasters. We live in paradise, we know that, but our mountains are steep, and we know the rains will continue to come. And when the rains come and they come in a short period of time, it causes all kinds of difficulties. There's ways to fix this stuff. We have to have an incredible cooperation with all of our agencies, but with that, I truly believe if we'll get all the smart people together, we can come up with ways, and we can come up with a way to do it without spending all the money in the world, and we can absolutely protect people and have this not happen. So it was good to go. You know, I've seen it 10,000 times. One of the reporters asked me, he said something along the lines of, what did you see in the eyes of the people that were still cleaning up and what they were doing? And I said exactly this, and I've seen it over and over and over. I saw us coming together as West Virginia again and again. Absolutely, it humbles me beyond belief in how proud I am of our people. Our people stand up, always, and they dig in, and they've got a real live grit about them. But the other thing that was unbelievable is, two of the gentlemen that we were talking to, that were cleaning up, and you could tell they just worked themselves to a frenzy. And one of them looked right at us and said, the mayor was in the vehicle with me, I was driving, and they said, we can't thank y'all enough. Really? I mean, really? Here they are, just stripping their houses and throwing away all kinds of memories. Absolutely, and they are thanking us? No. I turned to the guy and I said, it shows the level of courage that you have. It shows that you're a West Virginian. It just shows how great we really are. Absolutely, at the end of the day, we need to do everything in our power to try to help these people, whether it be to try to bring FEMA in or whatever it may be. With all in us, we need to try to help them. And with all that, we need to come through with measures that will prevent stuff like this from happening as much as we possibly can. We know it's going to rain, and we know our mountains are steep, and we know we live in paradise with the greatest people, period. Tough things like this are going to happen. But absolutely, the more we can minimize, the better off we'll all be. I ask all the residents, you can give us more and more info. One of the things, for the residents of that are in the state of emergency, whether it be Cabell, Putnam, or Roane counties, I ask you to keep records. Keep and document every single thing you do. I know that it's hard to believe, but everything you do, from the mileage on your vehicle to go to Lowe's to pick up stuff, to absolutely all your time, things that you would not even think about. Keep all the records and document every single thing you're doing, and call us. Please call us and let us know your situation, and let us be able to help you. The more that we get and the more information we have, the better response we'll have. And so please document everything. Please get in touch with us, and I commend all the people. I'd like to brag on them all day long. Whether it be emergency management, whether it be Homeland Security, the Department of Highways, I don't care who it is. We absolutely had everybody running to the fire. But you know what? There's no way it will ever be enough. We absolutely need to continue to march to that order. We want to do all we can possibly do, and then more. And that's what we're going to try to do. Okay, I have signed a proclamation officially designated tomorrow as our first ever Fentanyl Awareness Day in West Virginia. Tomorrow will be the first day of fentanyl awareness nationwide. The day will be designed to raise public awareness about this terrible, terrible killer that's out there on our streets. If you just think about it, fentanyl is involved in more deaths of Americans under the age of 50 than any other cause of death, including heart disease, cancer, and all other accidents. We got to do something about it, don't we? We've got to raise some more level of awareness. Now, this won't be the end-all, do-all by any stretch of the imagination, but it is one more step to try to help. So remember that tomorrow. I've also signed a proclamation commemorating this week as the National Prevention Week in West Virginia. Every year, DHHR joins the Substance Abuse and Mental Health Services Administration to celebrate National Prevention Week. NPW is a national public education platform for communities and organizations to raise awareness on the importance of substance abuse prevention and positive mental health. Another great thing. And also, this is going to be this is the National Hospital Week. Now, let's just step back and think. Our hospitals have been pushed to the brink over and over and over. How important is a community hospital? How important is it? Is it not just about everything to us? Absolutely, without any question. National Hospital Week, right now. And so with all of that and everything, take time to thank all those that absolutely looked after us beyond belief. They ran to the fire. They ran right to the fire. And with all that, they treated thousands, tens of thousands, hundreds of thousands, and millions across this country. With all that, really and truly, how many lives did they save? It was unbelievable. And these people are great beyond belief. And our hospitals are our lifeblood. So that's all I've got. Please take heed. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And as the governor has said, we continue to monitor closely COVID-19 in West Virginia and in the U.S., and also try to look around the world to understand what risks might be coming to us. We see in the U.S. right now that we've about doubled the average number of COVID cases a day, and that is at the time that we are seeing the BA2 and the BA2.12.1 variants growing in the U.S. And as we look at our hospitalizations, we see about 1,000 more hospitalized people in the United States in April than we did in March. But we are also cognizant that as immunity starts to be reduced because of the time from the last vaccine, or if people have not been fully vaccinated, the time perhaps from the last infection that people had has a reducing amount of protection over time, which makes it really important for people to continue as we are doing in West Virginia, to very much know when your next shot is needed. And we encourage each West Virginian to be up to date with their vaccination. And the vaccine calculator, as the governor mentioned, is a great way to see where you are. We know that in, for instance, South Africa, they now have as high a percent positive rate for new COVID infections as they've ever had before. And that is because they are seeing another couple of variants, the BA4 and the BA5 variants of Omicron. And those variants spread faster than the BA1 or the BA2 or the BA2.12.1, which are the variants that we're seeing in West Virginia. So really, I know that's a lot of complicated words, but the key is COVID continues to mutate. And even though we know that it's really effective to have full vaccination to protect people against the most serious consequences and death from COVID-19, we also know that the new variants are able to escape the immune system a bit better. And the longer it's been since your last vaccine, the worse your immune system is able to function. So really, really important, particularly for our older people in West Virginia, to go ahead and get those vaccines and stay up to date to protect yourself and to protect each other. Because as we see that even though COVID is not being as severe as it was, say, during the Delta surge of COVID-19 with the Omicron variant, we're still seeing a lot of activity, and we still worry that the most vulnerable parts of our population could be at high risk of still having severe disease, hospitalization, and even dying of COVID-19. And as a country, we're right on the edge of seeing our millionth death from COVID-19, and that would have happened 27 months from the beginning of the pandemic. So remarkable that we have the vaccines that can effectively reduce deaths to close to zero if people are really up to date with their vaccines, and the fact that we'll be seeing 1 million people coming up really soon. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. As was pointed out, our hospital numbers are holding steady. So we'll continue to track hospitalizations and work with all to manage those efforts. As the governor and Dr. Marsh pointed out, we still have West Virginians who are using our vaccine calculator. 200,000 West Virginians have completed the calculation process. We will later this week see updates in the calculator to better help people with their due dates as well as the type of vaccine. And also later this week, we'll see a new section added to assist and support medical providers. The governor's been kind enough to give Dr. Marsh and I a lot of credit for that, but I want to point out 3 people from West Virginia University: Dr. Julia Frostino, Dr. Lisa Costello, and a non-traditional student, Steve Lowe, are the 3 people who are the brains and the brawn behind the calculator. So we thank them for the great work that they've done. They took up the governor's challenge of us as an organization continuing to be innovative in how we support people in COVID response and did a great job putting that together. Last thing, take the opportunity while I have the microphone to send thoughts and prayers from my family to the Forbush family. In a time when our nation seems to be so divided over a number of different things, from politics to other issues, to have a young man, 24 years old, who didn't care who was in the vehicle. He just ran to people in need and ultimately sacrificed his own life in an attempt to save others. And we certainly need more people like that in our country. And it's a true testament to our state. So I wish the best to the Forbush family, and we will keep them in our thoughts and prayers. Thank you.
Thank you, sir. Dr. Ayn Amjad, our State Health Officer, and Secretary Bill Crouch are also joining us today and are available for questions. We'll now go to questions from a member of the media. Today, we'll go to Charles Young with WV News first.
Hi, this is Charles Young with WV News. Governor, a couple weeks ago, I asked you if you guys were considering any sort of incentive program for the second booster shot aimed at those over 50. I wonder if there's any progress on that, or if that's something that's still on the table. If not an incentive program, are there any other new strategies we are considering to specifically target that population? Thank you.
Okay, Charles, I didn't get the beginning of the question, but I think it all centers around incentives to get more people with booster shots, and if that be the question and everything, Charles, we're working on it, and it may very well be that we go right back to where we were in trying to incentivize folks in any way we possibly can to get them across the finish line and get these booster shots, but we don't have any more details about that right now.
All right, thank you, Charles. Governor, I'll turn it back to you.
Okay. Well, I've got just a couple of things. One is, I always really pay attention to our experts, and Dr. Marsh, was telling about this variant in South Africa, and it's a spin-off of exactly what we've already been through. And everyone, I've tried to be so honest and so upfront with everybody. Everyone should realize with all in us that we wish in every way this was just gone. It's not gone, and it's something that we're going to have to find ways to live with. The likelihood of it just being gone are very minuscule. Absolutely, the likelihood of us being able to find ways to just live with this, we can do that. We can do it hands down. And how we do it. I know you get tired of me saying it, but it's 6,400 and some odd folks in the last 30 days have maybe not gotten tired of me saying it. Because 6,400 and some were for the first time they went and got their vaccine. Without any question, in South Africa, according to Dr. Marsh, we are seeing the spread of this on a significant level. Now, what's the odds of it coming here? Well, you know it's coming here. I mean, you don't have to be a rocket scientist on this one. It's coming here. And if it spreads faster than the other variants, we're going to have a lot of people get sick. Absolutely, you can stop this. Dr. Marsh, our coronavirus czar, Dr. Marsh says just a second ago that we, with the vaccines, we can reduce the probability of death almost to zero. I mean, come on. Come on, everybody. I mean, just think about it. This is something we can live with, and we can go on about our business, and we can go about all the fun in life and everything we want to do. You don't need to be sick. You absolutely don't need to be in a hospital or absolutely very, very much on your deathbed. We can avoid that by getting the vaccines. You know, we need to move on that before this thing comes from South Africa right to our doorstep again. It will. I'm sure it's already here. I don't know all the specifics, but without any question, it's here right now. We're seeing this variant now. Well, with all that being said, it will spread quickly again. It's not going to go away. It is absolutely not going to go away, but it is something that we can manage and then go on about our lives. Last thing I'd say is John D. Forbush. I really appreciate General Hoyer saying what he said. Because you know, this day and time, when there's an accident on the highway, most people are going to turn their head and say, I can't afford to get involved. You know, if I get involved, maybe somebody will sue me. You know, absolutely too many people, and this is a way of the times, too many people run away from the fire. For this family, we know they're suffering. You should be very, very, very proud of your son, maybe a brother. Absolutely, you should be very proud. So we thank you, and we thank him in every way. That's all I've got. God, please be with him and all of that family. Amen. Thank you.